Let me ask you something important. When was the last time you walked across a room and felt completely steady, confident that your feet were going to do exactly what you needed them to do? If you had to think about it for a second, this video is for you. Here's a number that I want you to really hear. 1 in 3 adults over the age of 60 falls every single year. 1 in 3. And falls are not just bruises and embarrassment. Falls are the #1 cause of injury-related death in older Americans. A broken hip can mean surgery, hospitalization, and for too many people, the beginning of a very serious decline. I'm Dr. Alan Mandell, and I've spent decades helping people move better, feel stronger, and live more independently. And today, I'm going to show you something that I genuinely believe can change your life if you let it. 4 simple exercises. You don't need a gym, you don't need equipment, you don't need a trainer. All you need is a wall, one wall, in your own home, and 14 days of commitment. These 4 exercises are specifically designed to retrain the systems in your body that control balance. And I promise you, by the end of this video, you will understand why your balance has been slipping, what is happening in your body, and exactly what to do about it starting today. Stay with me until the end, because exercise number 4 is the one that most doctors never talk about, and it might be the most important one of all. Let's get into it. First, I want to take 2 minutes to explain what's actually happening in your body, because when you understand why, the exercises make so much more sense, and you'll be far more motivated to do them. Here's the truth. Losing your balance after 60 is not inevitable. But it is common, and it happens for very specific, well-understood biological reasons. There are 3 main culprits, and I want to walk you through each one. Number 1, your proprioception is declining. Proprioception is your body's internal GPS, the system of nerves in your muscles, joints, and tendons that constantly sends signals to your brain, telling it where every part of your body is in space. Think of it like thousands of tiny sensors constantly updating your brain. Your foot is here, your knee is at this angle, your weight is shifting left. After 60, those signals start slowing down. The nerve pathways become less sensitive. And what that means practically is that your brain is getting delayed, blurry information, and it can't make the micro corrections your body needs to stay stable. That's why you might feel fine walking on flat ground, but unsteady the second you step on grass, gravel, or an uneven sidewalk. Number 2, your leg and hip muscles have weakened. I cannot overstate this one. Balance is not just a neurological skill, it is a muscular one. Your quadriceps, your glutes, your calves, these are the muscles that actually execute the corrections your brain orders. If those muscles are weak, even if your brain sends the right signal, your body can't respond fast enough or strongly enough. And after 60, without deliberate training, we lose muscle mass at an accelerating rate. Some studies suggest we can lose 3 to 5% of muscle mass per decade starting in our 30s, and after 60, that rate increases. Strong legs are not optional for good balance. They are essential. Number 3, your vestibular system is less sensitive. Your inner ear contains the vestibular system, tiny fluid-filled canals that detect movement, rotation, and the direction of gravity. When you stand up quickly, turn your head, or walk on an uneven surface, your vestibular system is constantly calibrating your sense of up. With age, The hair cells inside these canals decrease in number and sensitivity, which makes it harder for your brain to detect small shifts in your position before they become big problems. Now, here is the good news, and I want you to really hear this. The neuromuscular system responds to training at any age. Research is very clear on this. Your brain can form new connections. Your muscles can get stronger. Your proprioceptive nerves can become more sensitive. You are not stuck. Your balance can improve, often significantly, within just 2 to 4 weeks of targeted training. And that is exactly what we're going to do today. Now, why wall exercises specifically? 3 reasons. First, the wall gives you a safety anchor. You can touch it at any moment, which eliminates the fear of falling while you train your balance. And that confidence is not nothing. Fear of falling actually causes falls, because fear makes you stiffen up and shuffle, which is itself a balance problem. Second, the wall lets you control exactly how much support you use, from 2 hands to 1 hand to 1 finger to no contact at all. You can progress at your own pace. And third, you already have a wall. Right now, wherever you're sitting, there's a wall somewhere nearby. There is no barrier to starting this today. All right, let's get to the exercises. Exercise number 1, wall single leg stand. The first exercise is called the wall single leg stand, and this one directly targets your proprioception, those nerve sensors we talked about that tell your brain where your body is. Here's how you do it. Stand facing the wall, about 6 inches away. Place both hands lightly on the wall, just resting your fingertips, not gripping. Find a spot on the wall at eye level to focus on. Now, slowly lift 1 foot off the ground. About 2 to 3 inches is all you need, and hold it there. Your goal is to hold that position for 10 seconds to start. As you get stronger, work up to 30 seconds. Then, switch legs. Now, a few things to pay attention to. Do not lean your body into the wall. You should be using the wall only as a safety backup, your hands barely touching it. Keep your hips level. Don't hike up the hip of the leg you're lifting. Keep your standing knee soft, not locked. And fix your gaze on that spot on the wall. Visual focus is a huge part of balance. Here's how you progress this exercise over your 2 weeks. In the first few days, use 2 fingertips on the wall. When that feels comfortable, reduce to 1 fingertip. Then try hovering your hand near the wall without touching, just knowing it's there. And eventually, if you want the ultimate challenge, try it with your eyes closed. Closing your eyes removes one of your balance inputs and forces your proprioceptive system to work much harder. Start with your eyes open and earn that progression. This single exercise, done consistently, is one of the most well-researched balance interventions in physical therapy. It directly stimulates the ankle and hip stabilizers that are the first things to respond when you start to lose your footing. Exercise number 2, wall heel-to-toe walk. The second exercise is the wall heel-to-toe walk, and this one trains your dynamic balance, your ability to balance while you're moving, not just standing still. Stand with the wall to your side, about 6 inches away. Your hand can lightly brush the wall as you walk, but you should not be leaning on it. Now, take a step forward, placing the heel of your front foot directly against the toes of your back foot. Heel to toe. Heel to toe. Walk in a perfectly straight line, like you're walking a tightrope, because in a sense, you are. Walk about 10 to 15 feet, then carefully turn around and come back. This looks simple. I promise you, try it and you will feel exactly which muscles are working. The reason this exercise is so powerful is that it mirrors the exact neural challenge your brain faces on unstable ground. When you walk on an uneven sidewalk, across a parking lot, or through grass, your brain is constantly managing a narrow, shifting base of support. The heel-to-toe walk trains that management system deliberately and safely. To progress this exercise, start slow, focus on control. As you improve, walk faster. Then add a head turn. As you walk, slowly look to the right and left. This mimics real-world conditions, looking both ways before you cross a street or turning to talk to someone while you walk. It's harder than it sounds, and it's exactly the kind of skill that protects you in daily life. Exercise number 3, wall-supported squat. Now we build strength because, and I will say this again, strong legs are balance. You cannot separate them. The wall-supported squat is your strength builder, and because your back is supported by the wall, it is completely safe on your spine and knees when done correctly. Stand with your back flat against the wall. Walk your feet out about 18 inches from the wall, hip-width apart or slightly wider. From there, slide your back down the wall, bending your knees until your thighs are at about a 45-degree angle. If you can go deeper to 90 degrees, where your thighs are parallel to the floor, great. But never go lower than 90 degrees and stop at whatever angle is comfortable for your knees. Hold that position. Start with 10 seconds. Work up to 30. Then slowly slide back up. Do this 3 to 5 times per session. What muscles are working? Your quadriceps, the front of your thighs, are working intensely. Your glutes, your seat muscles, are engaged. Your calves are stabilizing. These are the exact muscles that fire when you start to lose your balance and need to catch yourself. Building them here, in this safe, supported position, translates directly to better balance in everyday life. Here's the progression. Increase the hold time first, from 10 to 30 seconds. Then increase the number of repetitions. Eventually, add a heel raise at the end. When you slide back up to standing, come up onto the balls of your feet for a second. This engages your calf muscles and challenges your ankle stability at the same time. I want you to feel the difference in your legs after 2 weeks of this exercise. You'll be amazed. Exercise number 4, wall perturbation balance. Okay, this is the one I promised you. Exercise number 4, the one most people never do. The one that physical therapists use with patients after stroke, after surgery, after serious falls. And it is, I believe, the most important balance skill for everyday life. It's called perturbation training, and the idea is this. Instead of practicing holding still, you practice recovering from disturbance. Think about how falls actually happen. You're walking along, and suddenly there's a crack in the sidewalk, or a loose rug, or someone bumps into you. You don't fall because you weren't standing still well enough. You fall because your reactive system, your ability to detect and correct an unexpected shift, wasn't fast enough. That reactive system is a trainable skill, and this exercise trains it. Here's how to do it. Stand near the wall, close enough that you can touch it instantly if needed. Stand with both feet hip-width apart. Now, very gently, deliberately, shift your weight to the left, enough that you start to feel off-center, and then let your body find its way back to center. Then shift to the right, then forward, then back. You are intentionally disturbing your own balance in a controlled way and training your nervous system to recognize and correct that disturbance as fast as possible. Now add the next level. Close your eyes. When you close your eyes, you remove visual input, and your vestibular system and proprioceptive system have to carry the full load. This is where the deep neurological training happens. Start with your eyes open and small shifts. As your confidence builds, increase the amplitude of the shift. Add eyes closed. Eventually, you can try it on a folded towel on the floor, a slightly unstable surface, while standing near the wall. This is the difference between being someone who catches themselves when they trip and someone who hits the floor. That reaction time, that reflex, it can be trained, and your brain, at any age, will respond. Let me give you the exact plan. Week 1, days 1 through 7. Every day, set aside 12 to 15 minutes. Do the exercises in this order: single leg stand, wall squat, heel to toe walk. Save the perturbation exercise for the end of week 1, once the first 3 feel comfortable. In week 1, your hands can be in full contact with the wall when needed. Focus on form above everything. Feel what the exercises are doing. Don't rush. Week 2, days 8 through 14. Same order, same daily commitment. Now you start reducing your wall contact. One fingertip instead of a full hand on the single leg stand. Let your hand hover near the wall on the heel-to-toe walk. Add the perturbation exercise daily. By day 14, and I have seen this again and again in patients, most people report feeling measurably more stable, not just physically, but in their confidence. That confidence, by the way, is not a small thing. Confident movers have better posture, better gait, better reaction time. Confidence is protective. Keep a simple journal. Write down, how many seconds did I hold the single leg stand? How did the heel to toe feel? Did I need the wall? You'll be amazed at your own progress. Before I wrap up, I need to address safety because I care about every person watching this. If you have been diagnosed with Parkinson's disease, you should work with a physical therapist who specializes in movement disorders before attempting these exercises independently. If you experience significant vertigo, the room spinning kind, not just feeling a bit unsteady, please see your physician to identify the cause before doing any balance training. If you have had a hip or knee replacement or any lower body surgery in the past 6 months, check with your surgeon first. For everyone else, here are the universal safety rules. Always do these exercises near a sturdy wall or with a chair close behind you. Never do them in socks on a slippery floor, bare feet on a non-slip surface, or good athletic shoes. Do not train when you are fatigued, dizzy, or immediately after a meal. And always listen to your body. Discomfort from working muscles is normal. Pain in a joint is a signal to stop. These exercises are designed to be gentle. They are designed for people who are just starting to notice balance issues, not for people who are recovering from a serious injury. If you're somewhere in between, use your judgment, and when in doubt, call your doctor. Your safety is always, always first. Let me leave you with this. Balance is not a fixed thing. It is not something you either have or you've lost forever. It is a system, a neuromuscular system that responds to training. And training it does not require a gym or expensive equipment or hours of your day. It requires a wall and a decision to start. You deserve to walk through your life without fear. You deserve to get up from a chair without grabbing the arms. You deserve to go for a walk and feel the ground firmly under your feet. Those things are available to you. Your body has not given up on you. It's waiting for the right signal. Start with exercise number 1 today. Just that. 10 seconds on each leg. That's it. And build from there. I believe in what these exercises can do for you because I've seen it happen over and over in people just like you. If this video was helpful, please give it a thumbs up. It truly helps this channel reach more people who need it. And share it with someone you love who could use better balance. Subscribe to Healthy Aging America so you don't miss our videos every week on living stronger, healthier, and more independently. And leave me a comment below. Tell me which exercise you're starting with. I read every single comment, and I'd love to hear how this goes for you. Take care of yourself, and I'll see you in the next video.